president currently this year. So this is another adult forum that will be talking about the community outpost. I'm going to allow each of the panel members to introduce themselves and their organizations, and then comment on a few different things. Our council had put together some questions, actually the committee put together some questions that I had circulated among people. Hopefully everyone had a chance to read them. And just for your sake, they included, what is your organization's mission? What are they excited about with this potential partnership? What is the organization invested in doing with this project? And how is it going to affect their organization's goals? So those are the basic conversation or discussion questions that we ask each of the members to address. If there's time at the conclusion, we'll try to do some question and answer as well, if that works out. So, without taking any additional time of yours or theirs, I will pass the mic all the way to the end and we'll work our way up. Thank you.
Good morning, I'm Commander Marty Sayer, St. Cloud Police Department. I have the Community Engagement Division, and our division is the Cop House. Our department's mission primarily is to serve and protect the constitutional rights of the people in the city of St. Cloud. Along with that is a collaborative effort with the community to find solutions to problems. So that's why I'm here. I have a lot of one thing that I know is going to come up is the diversity of cop houses and what they mean. They're all different, their missions and their goals, and we have to define that clearly what this is with the foundation. But I'm happy to be here, and thanks.
Good morning, everyone. My name is Sonia Gillow. I'm the Executive Director of the Greater St. Cloud Public Safety Foundation. I want to let you know that on your table I have put our 2023 Community Impact Report. You're welcome to have one of those. And I will just leave you with our mission is to be the leading advocate of public safety in Benton, Sherwood, and Stearns counties in central Minnesota. Thanks for having us.
I'm Ken Bellico. I'm the current chairperson of the board of the Public Safety Foundation and is helping coordinate as a liaison in between all resources and trying to find a solution to what surveys represent as needs in certain neighborhoods. And we're happy to be here again.
Hi, I'm Heather Piper Olson. I'm the Vice President for Institutional Advancement at the College of St. Benedict, but I'm here representing both the College of St. Benedict and St. John's University. St. Ben's and St. John's are Catholic, Benedictine, liberal arts, residential, undergraduate college for men and for women, but we also have co-educational graduate programs in theology at St. John's and in nursing at the College of St. Benedict, which is partly why we are here. Mike, do you want us to answer all the questions now? Just interested.
Actually, go ahead.
Okay,
Yeah.
I'll go ahead and do the whole thing. All right, so we are, as I said, we're educational institutions, and what we're really excited about with this partnership specifically, and where we'll start, is with our nursing education program. So as I mentioned, we brought on graduate nursing programs, so specifically family nurse practitioner programs, as well as a leadership PMP, and then some masters in nursing as well. We have a long tradition of undergraduate nursing. Our founding order, the Sisters of the Order of St. Benedict, also founded St. Cloud Hospital. And at the same time, they separately incorporated St. Cloud Hospital and literally gave it to the city, to the citizens. They also separately incorporated the College of St. Benedict. But really it is a part of our heritage, our mission, and the core of what we do is serving this community's health needs. And that's partly why we brought in a graduate program, knowing that there was a need for more nurse leaders, more healthcare practitioners, and for us to be part of the creativity with that. We're also expanding health and wellness education generally at St. Ben's and St. John's. We think this is a core part of that because what it will do is it will allow us to do a couple of things. One, it will allow us to recruit more and retain our faculty who are all mostly doctorally trained nurses already. They are required to maintain their licensure by serving the community in clinic hours. They right now serve in clinic mostly with center care, but across the region. And this will allow them to do that within this community outpost. It will also allow us to train more family nurse practitioners because they are required to do that. We will be able to serve the needs of this community in this way. We also already have our undergraduate nurses doing clinical hours and lots of things, including diabetes prevention and other things that we hope we will be able to partner with this location to do that work as well. So it will help us recruit or train our nurses who need clinic hours, but it will also allow those same faculty members to train more nurse practitioners for this region. So we're invested in making sure that we can be a part of that and providing the actual providers who will be doing that. Hopefully, as we grow, we might be able to bring in other educational institutions and also healthcare providers who are looking to volunteer in a space like this. So really, at the end of the day, this will just allow us to continue to serve our educational purpose and mission. Oh, sorry. And give it to Mary first, because I passed it over to you.
Hi, my name is Mary Zelenak, and I'm one of the faculty at College of St. Benedict and St. John's University, the nursing. I teach in the undergrad portion of the nursing program. So I work with students who are already, as Heather mentioned, serving in the community. And one place is actually at the Southside Community Outpost. So our nurses, before they graduate, before they become RNs, do need to do a community clinical, work in a community clinical setting. So that would be our role here at the Community Outpost. And furthermore, it is in their public health course. So what they are learning about is that service and learning about communities that are underserved, populations that might have other social determinants that are not allowing them to receive their health care. So that's what we will be teaching our undergrads. And then, as Heather mentioned, what we will offer the community are things like diabetes prevention, hypertension prevention, perhaps some stress reduction, those kinds of things that our undergrad nurses certainly are happy to provide.
Good morning, everyone. Great to have you all here. My name is Dani Korvinsky. I'm a senior director in the area of population health at Center Care. And so you might say, population health, what is that? I like to say we are the people that care for the people that are caring for our patients. So really more in the operations sector. I oversee areas of health equity, community health improvement, coordinated and correctional care. And I've had the privilege of working with many of these partners here at the table for, many years up until this point. And it's just been very fruitful for our community. The mission of Center Care specifically is to listen, to serve, to guide, and heal. Because we want to care for our communities, not when they just need us, but every single day. And so when we think about our partnerships, 80% of what impacts health happens outside of the walls of the healthcare system. So that means in the communities, collectively, every single day. And so how do we capture those things earlier on and create more of an access point within communities of need? I would say too, one thing that I'm very excited about is to advance a space of evolution. So for the community outpost that is currently existing, that has really been an evolution over the years since I started working in that space since 2017. We go with the flow with what communities tell us they need. We continue to survey, we continue to connect and build trust. And with that, we can really get to the root causes of need, not just what we think communities need. The other component that I'm also really excited about is to create a space where we can provide increased access in the community. So for individuals that really do have needs, as Heather and Mary mentioned, Center Care is already serving that purpose of providing education, translating it into other languages, talking about resiliency. But the one thing that we're hearing from communities, particularly in this area, is how do we create a space for resources to be accessed all in one place? Whether you need to have someone help you fill out forms, help you navigate the health system, help do a little bit of education around a diagnosis, medication management. Not everything has to happen directly in the clinic. We have wonderful healthcare professionals, nurses, students that can provide some of that education and spend way more time while building those relationships and trust. So I think that's what I'm excited for, and I look forward to just working with this group, probably many of you, as we continue to evolve this community outpost initiative.
Thank you.
Hi, my name is Patty Allen, and I've been a member of Salem for over 40 plus years. And I currently serve on the task force related to the request from the Safety Public Foundation using part of our educational wing. So thank you for being with us and sharing with us your wisdom and willingness to engage in this outreach program to the East Side community. A little bit about Salem: we've been a member of this community for over 40 years. If you've reviewed our website, being with and in this community is not new. Part of our core values states our neighbors matter to us. Our East Side neighbors are diverse, and we want them to be in community with us. We are a church family, and this is our home. And so while we wait the vote of our congregation if approved, this will allow our church council to engage in the lease, and we enter the partnership knowing that we are blessed with the resources of our building to serve the East Side community. Thank you for being here and sharing with us your thoughts and your goals for the partnership. We are blessed with God who has invited us to share our building in a way that enhances our mission. So, indeed, as a congregation, we agree to this potential partnership. We look forward to working with you all.
Thanks, Jen. I'm going to ask the medical people first to comment. You've touched on it, but if you can comment with a little more detail, what do you foresee being your role here in terms of the students' center care? Because I think there's some, well, I'll just say, I don't think this is going to be turned into an emergency room or a clinic of that sort. If you could just talk a little bit more about those details for us. Thanks.
Yeah, I think that's a great question, and you're right. It will certainly not serve as like a minute clinic and or like an ER setting. The goal is to provide access to both kind of chronic disease management, but primarily acute care management, which is really just one-time onset when people need us. And so, for example, a lot of individuals that we see coming for patients in the community outpost currently, they have been undiagnosed with something like diabetes, they're not feeling well, they have maybe some type of infection, and so we serve as more of an access point. So we aren't continuing their care for a long period of time in that space. They can come and see us anytime, certainly for a nursing-led visit, or if we have a provider that's volunteering, or if we have like one-time monthly clinics in that space with providers, absolutely, that elevates that scope of care. But as a health system, what we do, knowing that we kind of oversee much of this area, is we say, do you need a higher level of care? If so, what is that? Do you have insurance? Do you not have insurance? Do you know how to navigate the health system? What type of labs would you have? Do you know how to manage your medication? Do you know how to administer medication? And so it's a little bit of a different approach that is tailored, particularly to the patient needs. And just to share a little bit more about center care's kind of scope and where we see this going, we have a lot of nurses who have diverse backgrounds. They speak a variety of languages, and they really do connect with patients that in some cases they feel a sense of mistrust, or they really are unsure of where to go in the health system. And so unfortunately, we do see very high ER utilization for patients that just are not sure how to navigate that system within their communities. And then that does ultimately lead to financial strain and things like that. So we want to help alleviate that and be a partner so they can have more autonomy in their health decision making. Just a little bit about the logistics from the St. Ben side, because I really do believe our nursing program will be running most of the logistics for this particular location. So we intend to start slowly and small, both for our sake as well as for yours. We're thinking probably once a week initially for several hours in the afternoon. So we have some stability as far as the way we're using it for our curriculum, but also so there's an understanding. Initially, we're thinking mostly daylight hours. I imagine, don't quote me on this part, but as we get there, we'll be more specific. But we're thinking, maybe 1 to 4, 1 to 5. Maybe eventually going to 6, so we can get folks after work hours. But that idea of maybe 1 day a week, Wednesday, right now sounds really good to our faculty. But really with the idea that we would provide immediate care. So it really is the idea if somebody comes in with a wound, they can choose us instead of going to an ER. But in that space, we would be providing care free of charge. The idea is not for us to immediately engage insurance, but for really to understand that we would be able to provide acute care in that location. If something is immediate and requires more care, our role would be to help them get to the ER, to urgent care, to a provider. But because we will be doing this under the umbrella of our nurses will be volunteering for center care. So center care will be the health system, the overarching health system. We will be able to put them in the system, engage them immediately, and hopefully also knowing that there'll be other opportunities for resources potentially from community providers. So that's really the first goal, but we also know as part of our undergraduate program, we do have these ideas of sort of that preventative care. How can we be a part of getting further upstream before we get to an acute care situation? We really do think there's a lot of opportunity there as well. But we're gonna start, like I said, specifically with those clinic hours. The other thing we hope to be able to do then is to provide any family or any other community members with the support that they potentially need, knowing that social determinants of health really are less about that moment and more about the wraparound services. So again, St. Ben's will be driving scheduling, they will be the healthcare provider on call in those situations. As I said, we have family nurse practitioners who lead that program and will be leading the clinic at that point. And they will be there precepting clinic hours for both undergraduate and graduate nursing students who will be involved in providing care.
Just one thing to add is, as a point of reassurance, there are models not only at the Southside Community Outpost here in St. Cloud, but across the United States that operate like we are proposing here as a community clinic. Nurse-led, nurse faculty supervised, undergrad nursing. So really utilizing those resources and developing that partnership between an educational institution and a health system to support the community. So our undergrad nurses for 3 years, and I think our graduate program for a couple of years, have been doing research on existing programs and have really kind of come up with some ideas of how this might work best. And then, so looking at programs across the country and putting that together with the demographics of East St. Cloud, looking at community surveys to really come up with some ideas and proposed solutions here.
Thank you. I'll pass it farther down now and introduce the question. I know that some of this is being modeled on Racine, Wisconsin, having 7 community outposts or cop houses or whatever the lingo is. Here now, it's my understanding, it's all of our understanding, that you're proposing 2 on the east side of St. Cloud. Is that right? Okay, and can you explain how they might be similar and how they might be different?
And I'll do this in concert with Commander Commander Sayer here. So effectively, the way the Public Safety Foundation operates the current South Side Cop House, we can refer to that as the Legacy Community Outpost. It is done so that we can take donations and in-kind efforts and create something out of more goodwill and donations. If it's run through a city, there's prevailing wage bids, there's other rules and legalities that need to happen. And typically, it will not happen in the same amount of time that a foundation can get something accomplished with the same partners. So we stood up the foundation in order to allow the Legacy Community Outpost to reach out to other community partners such as St. Cloud Rotary, the Optimist Club, US Bank, you name it. There's a lot of very important individuals and corporations that supported that. As we work towards growing this initiative in the community, modeling off of Racine, Wisconsin, which was where the first community outpost was, and then really they had half a dozen before anybody else had any. What they do is they go into each neighborhood and they say, what does this neighborhood need? And then they figure out how to supply that, okay? With the expansion into the idea of multiple on the east side of St. Cloud, so anything across the river considered east side, we're really looking at this current facility being the Salem Community Outpost, to separate it from the 1010 neighborhood. The difference being is the Public Safety Foundation would be generally fully in charge of standing up this community outpost and then operating it on a long-term agreement or an agreement between Salem and the Public Safety Foundation with the hopes of evolving it as the neighborhood needs evolve and potentially expanding or contracting services as they ebb and flow throughout the duration of this project. The 1010 park, I will pass over to Commander Sayer, but that will generally be initiated from federal dollars and then city funds initially, and then figuring out the partnership, how to operate that long term, is up to us.
So, I have different groups of people within my organization, and I guess I'll try to say, somebody brought up about a youth emphasis in cop houses, and how does this differ? So, every cop house is different, and every single one in Racine has a different, they have a common goal with some different mission statements as they work. If you look at the 1010 park concept, one thing that's very different about a cop house at this location is we're missing a park, right? That park is kind of key to a lot of our programs. So when we first looked at this, we're like, okay, this is an entire different avenue for us as a police department. So my South Side and the 1010 Park group is going to be a core group of officers that work with youth engagement in the parks. And well, obviously we got this model and we saw the medical aspect of it. And this makes a lot of sense for our community mental health team, co-responder team, and the community paramedics to function out of this location. So overall, yes, the funding for that particular area, and we still have to work on the details. And someone says, why do you need 2 on the east side? Well, I want to have 2 on the west side, eventually maybe 3 to 4 on the west side. We have plans right now that we have one north, south, northeast, southeast. I worked in the city for 28 years, and you know, the missions that this one would have compared to the 1010 Park on the southeast side, totally different. Different police officers, and different mission statement, what they're trying to accomplish in the community. So there's the group of the community response team itself. I look at the south side and the 1010 Park, those personnel, the community response team, working at that because they collaborate specifically with youth and what their goals are. You know, they have a hockey program, they have a fishing program, they have all the stuff that youth engagement. The group that will come here, some of you might know Sergeant Tad Ashen, who's also worked for a couple decades in this city. He would be heading up the group that would be working out of the Salem Cop House. He has 2 officers that work for him specifically with the co-responder group, and that's comprised of, and you want to know what would it look like day to day, and this is my vision. There is a vehicle that they have dedicated to what they do, and they go out and take calls for service from the city of St. Cloud relating to, specifically to mental health. So it's a mental health professional. It is a community paramedic. Hopefully those 2 can do their jobs without police intervening. But what we've learned is that the community that we serve, sometimes they engage with the police officer far better than they do with the mental health professional, and vice versa. Or they'll want to talk to a paramedic. It's the passions, experiences they've had in life. And if you get those group of 3 together, you know, if they don't like the police officer, you can back them out of this and let the mental health professional do the work. It's an amazing, the idea of a co-responder group working together is nationwide now. It's communities we found that, you know, they don't want that line patrol officer coming in and dealing directly with mental health. Our cops are really good, and they have to deal with a vast, diverse group of calls for service, but we're not mental health professionals. What this place does for us, it gives us a place to house that core group outside the police department. I want my cops out in the city, out in with the community, and this is an ideal spot, I think, for that particular group.
So when they go on a mental health call, do they come back here to help that person, or what happens from when they go out to a call?
The vast majority of the time they would not. They would deal with center care or different places. Could this be a location where they have meetings, where they would, you know, have scheduling, or we work collaboratively with the people that are working on the building itself. One thing I'd like to emphasize is really what, if you think of the term cop house, it's community outpost. Everybody thinks, well, why is this police focused? It's not. None of these are police focused. We just provide the public safety that goes along with the house.
I'm going to keep it down here for a little bit. Yeah, I think there is some concern, and you just touched on it, about having conference space here at Salem being used for interrogation rooms or for a temporary hold as a jail, that sort of thing. Thanks.
No, this would, you know, the worst case scenario is, and which is a good thing, at 2 in the morning, if our cops have access to this, they're gonna wanna come to this place so they can go have lunch and watch TV. That's what we do in our Southside one. We're building this into our 1010. We don't want all of our cops going to have lunch at the police department. Stay in your beat, stay in your location. This would not be a place where we put in a form. Our interview rooms have to have certain things. So audio, video recording, there'd be no intention to put any type of interrogation. We don't call them interrogation rooms. Interview rooms. Yes. So we do interviews. There would be no type of holding cell here, anything along those nature. The vehicle that we're building allows us to do that. It actually, if we have somebody in crisis and they are being taken into custody, the last place we take them is Salem Lutheran Church. Okay. We have other facilities for that.
Thank you. Yeah, my entire police knowledge comes from Hill Street Police. That's the last show I watched. Sorry. Kim, maybe you can address a little bit too, how this is going to be paid for. Can you deal with that issue?
Then we're gonna pass a hat after this meeting. So part of the Public Safety Foundation, the community driver is influence and connections. And we attempt and rather successfully have connected those. And we lean on partners that we've created with the initial community outpost and through our, and we have a wonderful group who support us. Subaru, Share the Love, just raised, well, in the last 2 years, they raised almost $175,000 through their campaign, national campaign, provided to us. We have naming rights to certain facilities within, or certain rooms within the facility that we offer. We had initial seed money from St. Cloud Rotary Club, who does Summertime by George, and that programming. We have the Optimist Club. We have individual donors. We have anonymous donors, whether they're corporate or individual. It's really people find hope and promise within our mission, and we do what we say we're going to do. And when we do that, we have people coming back to us saying, when are you doing the next one? We want to be a part of this. I know Landwehr has a whole bunch of equipment out here on 23 and 10 that's getting in our way, but they keep knocking on our door saying, when are we tearing something down again for you? When can we use our equipment? And we continue to talk to them and say, we're trying, we're getting this moving, we need the right partners involved so that we can lean on those individuals. The last community outpost that we did, Landwehr came in and tore down a house that was, would you define that as crime-riddled area in that home? Yeah, a few hundred calls within a couple of year period to that one address. In that scenario, we went in and we just tore it down, got rid of the whole thing. It wasn't a brick worth keeping there. And then because of the connections and because of how we can operate as a foundation, as we're placing block foundation in the hole that's there, we have union workers next to contractors, next to owners of companies, all doing the same thing. That's hard to coordinate unless you have a really good mission and a purpose. And we've created that, and people are attached to that. We will have a substantial funding drive, but that's on us. We will take care of those things. Whatever we decide in tandem with Salem that gets built out within this facility, if you see it fit, we get to figure that out. And you know, if that's a $250,000 lift, if that's a $500,000 lift, we're not generally concerned with our ability to raise that rather quickly and easily, and then continue to tap into those resources for the ongoing funding that needs to be there to operate our facilities across the board.
So I am originally from the Stillwater area, but I've lived in this community with my husband and daughter for probably 35 years. And in this community, I've worked in nonprofit and higher ed. My husband and I own a manufacturing company. One of the things that I think is remarkable about this community is we are large enough to have resources. We've got great businesses in town. We've got service organizations that are active and committed. Yet we're small enough to get all the decision makers in one room. So a week ago, we had a meeting of the partners of this project out at St. Ben's, and we had Centricare, and we had the police chief, and we had Heather from St. Ben's. So we're able to make decisions and get things done. Where in a lot of other communities, I think there either are the resources or it's so big that you can't get all the people together in one place to make something happen. So we saw that happen in the Southside Comp House. And I think we're seeing that happen here. We've got the folks here at this table part of the neighborhood, your business owners, your educators, your intelligent people who have a passion for healthy communities. And I think that's really one of the strengths of our region that gets overlooked. But that is really, truly how things get done and why some of the work we've done in conjunction with our partners has been so successful.
So, and one thing I want to ask, so it's crystal clear, you're not going to be asking Salem to pay for the work that's being done. I just want to make sure everybody hears that. You're not asking Salem to make any type of payment toward this. Thanks.
The business model that we're looking at here is a little different than the south side, as Ken mentioned. Our foundation purchased the property, tore down the old building, and built a new one. So our foundation owns that building down there. And then out of that, we've got the St. Cloud PD operates out of there, Centricare, St. Cloud School District, and also Stearns County Human Services, all lease space from us. And that's how we keep the lights on. It's really a minimal amount, but we own that building. Now in this case, and we've heard from a number of people that every community outpost is different based on the needs of the community. One of the things we looked at when we were looking at this neighborhood, knowing that we'd like to provide resources here, we looked at purchasing some property, a lot across the street that was owned by Quick Trip. In that case, we thought we would build something. Quick Trip wasn't interested in divesting of that property. So then what other options are available? We looked at the bank next door. It's a huge building. It would cost far too much for us to make that work. It's more space than we needed. That just really didn't fit what we could possibly do. And then your pastor and Brian Myers had a conversation about, we have some space here at the church. Maybe that could work. So in this case, the business model that we're currently thinking of is that if you are interested in leasing space to us, we would lease that. And so you would continue to own the space. We would have a formal lease agreement. We're hoping it might be long-term because that generally works best for everybody. But so you would actually get revenue from leasing the space. We, at this point, and again, all this will be documented in a lease, but it's likely that we would pay for our own utilities, for example. We need to work that out with our partners, right? So a lot of those details remain to be seen, but as I understand it and as I see it, and I'll hand this over to you after I'm done, is that we are not expecting you to contribute any money. We would lease space from you. We would be fully responsible for all the remodeling and the build-out. So no, my understanding of the plan is that it would not cost this congregation any money.
When we move to the fundraising piece of it, after we have a plan in place and we have the opportunity to have a lease in place, that's when we would start to figure out where the dollars would come in. If Salem wanted to donate, we'd be happy to accept that donation. However, it's not a scenario where we're going to go in and say, okay, well, if we have to move bathrooms and create new, more accessible bathrooms because of a space being changed, we're not going to come in and say, well, that's your space, so you have to take care of it. We're going to go in and say, well, we caused it. We're going to fundraise and we're going to find partners that want to put their little name plaque above that bathroom. However, we are allowed to work with the space. We will consider all options in funding in order to make that happen. But the idea at this point is that we don't come back to Salem and add any burden. Our hope is to remove burden from the church.
The other thing I will just say is every single partner involved here is either public or a not-for-profit. And at the end of the day, what we really are trying to do, again, we will be providing healthcare free of charge. The goal here is for us to use our resources. We have donors who are also committed to serving our nursing program, our student scholarship, all of those things to make the education we provide possible, and therefore the services we would provide this community possible. At the end of the day, that's the goal. So really what we're looking for, I think, from everyone sort of is that understanding, the way that we can do this, that best meets the needs of the community, but also does so in a way that's efficient and effective, and I think very much reflects the culture and the values of Salem. And that really is the same thing here. I think you'll get that from CentraCare, you'll get that from us. What we'd like to do is all the resources that we all have, the limited resources we all have, we want to use them to truly make this community better and stronger. So I think always keeping that in mind as we make any decision, whether it's in our situation, CentraCare's, Salem's, Police Department, or the Public Safety Foundation. And our donors will expect that from us as well, and that's partly why they're really invested in what we all do.
I think from the CentraCare perspective, I just want to reiterate too, so when you think about the College of St. Ben's and the College of St. John's, they will be driving a lot of this. And really, CentraCare is just a supporter. Certainly, we are invested fiscally. We're passionate about this. We have individuals that live in this community that go to this church that want to donate. They're really passionate about growing that workforce of upcoming individuals. But what we see is a commitment to say, how do we help you do this? So CentraCare's name will not be on the clinic. It will not be a CentraCare clinic. This will be a community outpost space where we're serving the community. We're just providing some of our resources, like our electronic health records and things like that. So we're just equipment, supplies, computers, things like that. So just to kind of reiterate that space.
It is 10:30, and that means we do have a service that's about to begin. I want to thank you all for coming this morning and giving your time. We do have a congregation meeting in 2 weeks, at which point in time we're going to anticipate take a vote. Between now and then, if I can ask, will all of you make yourself available, not for another meeting necessarily, but at least to respond to some questions from our congregation, as you've answered many, but you probably brought up a couple more. So I really appreciate Jen too for everybody coming this morning. Everyone out here, you have a question?
Yeah, thanks, Mike. If anyone has any questions, if they can find a piece of paper, pencil, write their question down, hand it to me, or Mike or Jan probably, and that we could get those questions answered.
Yeah, absolutely. And if during the week, obviously Juliet is going to be around, she's dropping off at the church office, and she's excellent at getting our attention with the questions that you have. So thank you all for coming this morning.
Oh, one more thing, sorry. I need their name and contact information on that question so that we can contact them.
Got it. Okay, I'm going to try one more time. Any more? We good? Okay. So it's 10:30. Thank you all very much for coming, and have a great day.